This is World Diabetes Day today, so throughout the world there are various things going on to raise awareness of diabetes. It's an enormous problem, and we're particularly here because this is an area that has quite a large South Asian population, and people of South Asian origin have up to 6 times the risk of diabetes compared to people of white European descent. And so we want people to be aware of the symptoms, we want them to be tested today so that we can maybe signpost people to their GPs so that they can get a diagnosis if necessary. But even if they have diabetes, we want them to know more about their diabetes, get them a bit of support, get them a bit of information.
There's a lot of people when they say blood glucose test, they're like, oh no, needles, they're scared of needles. And then here today we had a lot of patients and they were kind of a bit worried and scared about it, but then we just said it's literally just a wee pick on the finger. And then we had another patient, and that patient had a high blood glucose level, so we told her to see the doctor because it's really important.
We have had actually some good feedback from some people here today, and they've invited us back to the community centre in the next few weeks to engage with more and more people, which has been really good.
If we can identify people with diabetes that aren't diagnosed, we can get them into the system, that can potentially save them from blindness, from amputation, from kidney failure, all of these things that can be prevented if management is good. So if we can get in here and raise awareness, get people knowing about the disease, looking for the symptoms, we can potentially not just work for the common good in general terms, but in specific terms, we may be actually saving lives and limbs. So I think it so fits nicely in with the university programme.